Hello and welcome to Health Affairs This Week. I'm your host, Jeff Byers. We're recording on January 23rd, 2025. Before we begin today's episode, I wanted to shout out Health Affairs released not one, not two, but 7 ahead of print articles this week. All papers are a part of Vital Directions in partnership with the National Academy of Medicine. The current series focuses on 6 priority areas in U.S. health and medicine, including modernizing public health, advancing the biomedical research enterprise, charting new directions in women's health, safely integrating artificial intelligence throughout the health system, addressing the impact of climate change on health and equity, and transforming the U.S. healthcare system to one that performs at par with the systems of other industrialized nations. Check out the collection in the show notes and pre-order the February 2025 issue to get yourself a hard copy. We also kicked off a new Forefront series this week. Chris Fleming, first off, Health Affairs Forefront editor. Welcome to the program. What numbered sponsored series is this? The 11th?
It feels like that. I'm not sure exactly, but it's been a lot. Let's put it that way.
That's right. Well, congratulations on the launch. It's called Health Policy at the Crossroads, and the first article was written by Katie Keith, whose affiliations past and present include Georgetown Law and the White House, who also joins us today. Katie, Chris, welcome back to the program.
Thanks, Jeff. And I really want to note that we're welcoming back an old friend to Health Affairs, Katie Keith. Katie, as many listeners will know, wrote rapid response pieces for about 5 years for the Following the ACA feature on Health Affairs Forefront. She took over from the inestimable Tim Jost. She did that work for, as I say, for about 5 years, and then moved over to serve in the White House in the Biden administration. And Katie, I want to welcome you back. And I'm hoping you could, before we get started, just give the listeners the Reader's Digest version of what you were doing at the White House.
No, I was so excited to join. It feels very much like coming home. So thank you for having me today. And so in my role at the White House, I was the deputy director of the first ever White House Gender Policy Council. And so worked on a range of healthcare issues, but was really responsible for our domestic policy portfolio. So that definitely included things like women's health, reproductive rights, research on women's health, but also other issues like women's economic security, gender-based violence, and other sort of major priorities for the Biden-Harris administration.
Well, the good news, of course, as we mentioned, is that Katie is going to come back and pick up where she left off, or at least in a similar spot. She'll be doing the same sort of rapid response analysis that she did before, this time for the new Forefront feature topic that Jeff mentioned, Health Policy at a Crossroads. We'll use this new topic to chronicle the major impacts on health policy that may come and, in fact, are already coming with the advent of the new Trump administration and the new Congress. Katie wrote the first piece in this new topic on Tuesday, and I really recommend the entire piece to listeners. We'll talk about it some today, but we won't be able to get to all of it by any means, and we'll put the link in the show notes. And after this week, Katie will be taking some well-deserved time off before returning to Forefront in March. And we'll have other contributors in the space in the meantime. So, Katie, I mentioned that you wrote this piece on Tuesday that kicked off this new topic. You talked about the sort of developments that you and others would be watching, ways the new administration and Congress could impact health policy. You broke them down into several buckets. So let's start with the one that you mentioned first, executive orders. Now, many of our listeners are going to be familiar with the idea of what executive orders are, but for those that aren't, could you talk a little bit about sort of what the nature of the beast is, what an executive order can do, what it can't do, so people have an idea of what we're talking about?
Yeah, absolutely. So executive orders are really used to set administration-wide priorities directly from the president. These are executive directives that I think really kick off the regulatory process and set the tone, if you will. So this is very much, I think, again, the jumping off point for most administrations. So you asked what executive orders can't do. What they can't do is change existing statutory law. They can't immediately, in most cases, certainly in healthcare, sort of make immediate changes to regulations, to guidance, to the frameworks that have already been set out and that already exist. Really, it's sort of the beginning of that process. So, we'll get to exactly what has happened this week already. We'll probably have a bit of a touch point to some of the prior executive orders that President Trump signed during his first administration, I think gives some indications of what might happen here. In terms of executive orders, especially on healthcare, they don't change anything immediately, it really becomes the map, the framework to start watching what might be affected in the near and long term, if you will.
Well, and let's get to those specifics. You mentioned that there were several executive orders that were issued already that talk about healthcare and health policy. Give us a few of the most significant ones, and then you mentioned sort of what we can expect down the line from what came in the first Trump administration. Talk a little bit about those specifics.
Yeah, and I might even start with a bit of that contrast point. So if folks will join me on a journey back to 2017, the first executive order that President Trump signed on his inauguration day in 2017 was actually focused on repealing the Affordable Care Act. So it was a broad directive that said, it's the policy of my administration to support the swift repeal of the Affordable Care Act, which was a hot topic, if folks remember, in the 2016 presidential election and race. And it directed agencies to sort of take whatever flexibilities they could, grant waivers, grant exemptions from all Affordable Care Act rules, to the extent consistent with law. So that was the first thing he did as president in 2017. In contrast, we really did not see a ton of healthcare action, certainly not on coverage and care on day one, fast forwarding in 2025, which I think shows a lot about how the politics of the Affordable Care Act have changed, but also I think the focus of what this presidency might be about. So instead, you saw a lot of executive orders on immigration, on energy, on the federal workforce, and things that will certainly have downstream impacts on healthcare and coverage, access, and health disparities, and a whole range of other topics. But healthcare itself was not front and center. That said, there were a couple, more directed EOs, executive orders, One of them, begins the process of withdrawing the United States from the World Health Organization, which is a tremendous deal for, public health experts who've been raising alarms about this. This is something that President Trump tried to do in 2020 at the height of the COVID pandemic and was a campaign promise. And so I think no surprises that he signed an executive order beginning this effort. But of course, folks are concerned that this is going to impact our pandemic readiness and U.S. leadership in global health all around the world. So that was certainly one big thing that he did. Another one, it was not really an executive order. I read it as more of an informal directive, but in an effort to address emergency price, I'm using air quotes, you can't see me, but price relief had a focus on healthcare, but we don't know what it means. I think it was a pretty broad directive, and even the fact sheet and other materials coming out of the White House did not really clarify what that might mean. So that's an issue that I'll certainly be watching and covering over time as we get more details there. Maybe two more to highlight, and then I'll talk about some of the rescissions. There was an incredible amount of focus, not just on day one, but throughout this week, on diversity, equity, and inclusion executive orders. And we're actually already sort of seeing that have an impact on HHS specifically, as, I think there are questions about what it means for, very long-standing institutions at the Department of Health and Human Services. The Affordable Care Act created the HHS Office of Minority Health, a lot of operating divisions within HHS. I'm thinking, CDC and NIH and other divisions. I think there's maybe 7 of those centers and institutes on minority health. It's an open question to me of what happens there, given some of these directives and how much closing health disparities has been a focus of the Biden-Harris administration. Another is a very sweeping sort of anti-transgender executive order that I covered a bit more in the piece if folks are interested, but that's undoubtedly going to impact, I think, the healthcare of transgender people and certainly some of the future rulemaking and guidance that we're going to see coming out of the Trump administration. And those are just some of the things that were issued on day one.
Well, thanks, Katie. And you mentioned also that some of what President Trump did rescinded some of the Biden administration's executive orders. Can you talk very briefly about that?
Yeah, absolutely. So President Trump did sort of a sweeping executive order rescinding or revoking a ton of Biden-era executive orders. And there was actually a quite long list on healthcare. So this included Biden-era executive orders on prescription drug prices, on the COVID-19 pandemic, on the Affordable Care Act and Medicaid, on artificial intelligence, racial and gender equity, a whole bunch of stuff in there. I noted this in our piece. Interestingly, to me at least, he did not sort of target any of the executive orders that President Biden signed on reproductive health care. He has not yet reinstated the Mexico City policy. I don't think that means those aren't coming. It's just sort of notable to me that they were not exactly day one priorities, if you will. I will also say, in full disclosure, another one of the executive orders that the president revoked was President Biden's executive order to create the Gender Policy Council, where I was deputy director, again, for the past more than 2 years. And so, again, maybe a reflection of some of the priorities there, even though truly, so I would say most of the healthcare action we saw on day one was much more about rescinding old things. I don't think it tells us, though, much about the direction that President Trump is necessarily going to go in. And so I think there will certainly, given his history of executive orders and healthcare policymaking, there's definitely more to come. I just think we don't know that much more than we did before the inauguration, for what that's worth, Chris.
Well, I do want to. I want to make sure that we leave time to talk about what's happening legislatively, and there's some important movement on reconciliation legislation that could have a lot of impact on programs like Medicaid. But before we do, I want to move quickly through a couple of the other buckets that you mentioned. The regulatory realm, obviously, there are a lot of regulations that the Biden administration put in place, but there are still ones that are in the process of being implemented. And then there's litigation. There's a lot of ongoing litigation that has to do with health policy. In those two areas, can you talk a little bit about what we've seen so far?
Yeah, absolutely. So in terms of regulations, I think no surprise, this is pretty normal for incoming administrations to do this, but there was we call a regulatory freeze policy put in place to essentially say, hey, don't publish anything new that was going out the door until political appointees have had a chance to see it. And then even for things that have been published recently in the Federal Register but have not yet gone into effect, let's hold off. Let's take a look at those. And basically, it's a request to revisit if there's any questions of policy, fact, or law that the new administration might want to take a look at. It sort of puts a freeze on those from going into effect. I will say I think the Biden-Harris administration was paying attention to this issue. And so there's actually, from my review, not a ton of major healthcare rules tied up in this regulatory freeze. There were several rules that have already gone into effect, so technically wouldn't be impacted by this. I think the most notable one was one on telehealth access for controlled substances. That was a joint DEA and HHS rule that, the Trump administration will have to grapple with, but definitely seems like the Biden administration sort of cleared the decks on some of these major healthcare rules, at least.
And then on litigation, I mean, we've got the Braidwood case, various important cases that are moving through the process. What's happening there?
Yeah, I think it's an open question, and I think each case is going to be different. I think if past is precedent, we can look to some of the ways that the first Trump administration addressed some of the pending litigation. You mentioned Braidwood, which is the preventive services challenge that is pending before the Supreme Court. I'm watching and waiting to see if this sort of new Department of Justice takes a different position in that litigation. Ditto for a lot of the pretty high-profile reproductive rights cases, cases on medication abortion, on the HIPAA reproductive health privacy rule. In general, I would say, the Department of Justice historically has defended statutes and positions over time, but you could see a world where the Department of Justice asks for rules to be remanded to an agency because they say, hey, we want to take another look at this. That's something that was a tool used by both the Trump and Biden administrations for sure. You could see maybe this administration doesn't appeal adverse decisions in the district court and sort of lets those stay. You could see them changing positions. And if folks, again, will join me on a journey back in time, the California versus Texas case over the fate of the Affordable Care Act was an example of a really high-profile case where the Trump administration changed their position and did not defend, the full constitutionality of the Affordable Care Act. And that led to a Supreme Court decision in 2021. So I think you can count on Forefront and me and others to, I think, be talking about a lot of these issues as they come up. I think it's too soon to know, but definitely going to keep an eye on the courts.
And then finally, as I mentioned earlier, we've got the legislative branch, and there we'll be watching several things, but certainly this budget reconciliation mechanism that's important because it allows the closely divided Congress, it allows the Republicans to bypass a Democratic filibuster in the Senate. What's going on there, and can you talk a little bit about the possible impact to, as we mentioned, Medicaid and other health programs?
So 119th Congress has a very packed agenda. They have the Government funding will expire in mid-March. They have appropriations that they need to get to. They have the debt ceiling limit, and they have budget reconciliation, even as they are trying to decide, what that package looks like, and is it one bill or two bills or more than two bills at this point. So I think in terms of budget reconciliation, what we're seeing so far is a lot of discussion about potential pay-fors. And so, as you mentioned, Chris, I think some really, if they come to pass, really significant changes to the way Medicaid is financed, to the way states receive Medicaid funds, to, undercutting things like Medicaid expansion. Many of these ideas, I can't remember if all of them, but many of them, I think, were bandied about in 2017 during efforts to, again, repeal the Affordable Care Act that failed multiple times. And then the history there, of course, is Republicans did go on in December to pass the Tax Cuts and Jobs Act, also using budget reconciliation. And so I think definitely a huge issue to watch, and could mean, I think, significant changes to certainly health policy, but healthcare financing writ large. I think big questions about what happens and will this be successful, and what it would mean in terms of impact on people's lives, money flowing to states, support for the healthcare industry, lots and lots of questions that we'll just have to watch play out. But in some ways, everything old is new again. And so we will need to see how much of this sort of plays out over time.
Let me toss it back in 1 second to Jeff to close us up. But very, very quickly, can you talk a little bit? There's something called the Congressional Review Act, which allows Congress to pass a resolution, and the president has signed it, that would disallow regulations that I think were not passed by a certain threshold. Are there any health policy regulations that it might be on the chopping block there?
Yeah, great question. So the Congressional Review Act, well, based on this new administration and the calendar, I think expectations are that this mechanism that you just described, Chris, which is, I think, useful to people or attractive because it only requires a simple majority in both chambers. So it does not require 60 votes in the Senate. It's a simple resolution that, when signed by the president, can invalidate a rule issued in the last 60 legislative days. So what that means right now, I think the ballpark is mid-August. So Biden administration rules that were finalized from mid-August on could be subject to one of these resolutions that would invalidate them. The kicker there, what makes this such a sort of blunt and potent tool, is it would prevent any future administration from doing a rule that's substantially the same. No one really knows what that means. It has not really been tested in courts. I think there's only twice that rules have come back that have been subject to a CRA. And again, we just don't know exactly what that means. In terms of healthcare rules, the Biden-Harris administration was paying attention to this. It is why I think you saw so many significant rules go out the door in April and May. I know I was working on many of them during that time. I think the Obama administration maybe had not been as focused on the potential use of the Congressional Review Act, and it was used by Republicans in Congress in 2017 to knock out, I think, 16 rules promulgated by the Obama administration. I will say it has not typically been used against a ton of healthcare rules in general. And there weren't a ton, again, that have kind of been pushed out since mid-August, by the Biden-Harris administration, but definitely one to watch. And that said, even outside the Congressional Review Act, there has been sort of interest, I think, from Republicans to maybe knock out or invalidate or repeal some of the Biden-era regulations, including some that might have a significant impact as a pay-for in their budget reconciliation process. So more to come there. It doesn't mean that regulations, Biden-era regulations, are not on the chopping block or being targeted. I want to be very clear about that. Just seems like a lot of the work was done in advance of that sort of very important Congressional Review Act deadline.
Well, Katie, it's been fun, and we'll be sorry to lose you for the month of February, but enjoy your time off, and we'll look forward to having you back. And again, listeners, I really recommend the entire piece. There's a lot in there we haven't had a chance to get to today. And Jeff, I'll turn it back over to you to close us on up.
Thanks, Chris. Rob Lott, I see you in the Spotify comments. Thanks for putting that in there and for the nice words about the good episode. If you're on Spotify, put some comments in there. Be interested to hear from audience on that. Katie Key, thanks for joining us again. It's happy to have you back. Chris, as always, happy to have you back as well. Yeah, we'll see you next time on Health Affairs This Week. If you enjoyed this episode as a listener, send it to the Politico in your life, or, go to the source, send it to Politico. Let them know this podcast exists. And with that, thanks for listening, and we'll see you next week.